we're going to be honest, it's not just the pandemic that has shown that our healthcare system is struggling to meet the ideals that Canadians put forwards on it. Canadians believe it should. And that's why we recognize throughout the pandemic, even during the pandemic, the federal government, which isn't in the business of delivering the healthcare systems across the country, that's the role of the provinces. The Constitution sets that up, and that's the way it works. We send about $45 billion a year, every year, to the provinces. But on top of that, during the pandemic, the federal government spent about $72 billion more for everything from PPE to vaccines to just extra injections of cash into the healthcare systems to be supportive through these difficult times. Now, I'll be honest, over the past many years, every 5-10 years, depending on the cycles and the governments in place, federal government sits down with the provinces and negotiates more money to send into healthcare. And that's fine, and it's important. But the challenge is, the way our Constitution is set up, the federal government isn't the boss of the provinces. We are partners in running this country. The federal government takes care of sort of the national and international things, whether it's foreign policy, military, federal taxes, things like environment, or things that cross borders, protecting French and English. These are all things that we do as a federal government. Provincial governments deliver social services, whether it's K-12 education or healthcare. Those sorts of things is quite responsibly something that varies enough from province to province that the local provincial governments deal with that. So we don't get to say, okay, this is how you have to spend your money on healthcare. Because provinces have the expertise, and provinces are connected, and provinces run the systems. But what we've done slightly differently this time is say, okay, we're going to send you money on healthcare, but it's going to have to be in 4 different areas. And one of those areas is data, transparency, and accountability of results. You all know how important it is to collect good data in healthcare. And the idea of someone showing up at an emergency room and the doctors there have no idea what specialists you've just seen, what tests you've just had, even who your family doctor is, particularly whether you do have a family doctor or not, and that's something, is one of the other priorities we have. Or the fact that we have 13 different major health systems across this country with our 13 provinces and territories, and yet we cannot compare outcomes from one to the other because everyone collects data slightly differently, is a barrier to actually learning from successful innovation from one area to the other. And for Canadians who choose to shockingly move from one city or one region to another, making sure there's a continuity of care. And you should be able to have access seamlessly to the health records and the health care that you need. So getting better information will ensure better outcomes, both within the systems and across the systems.